Hi, I'm Corey. I'm one of the recovery nurses here at Slocum Orthopedics. I'd like to go over some discharge instructions with you if you've had a repair of the shoulder. Anybody who's had a repair of the shoulder will get a regional anesthesia block before surgery to help in post-op pain. So this will all be done in pre-op. The anesthesiologist will utilize an ultrasound and they'll go kind of in this neck area, whichever side they're working on, and they'll deliver some medication around the nerve root that innervates the shoulder and arm, and it will theoretically numb the arm for 15 to 18 hours. Okay, that's the original first nerve block. If you get a catheter, which is a little secondary piece, they'll leave a catheter in that location right at the nerve root, and it'll be attached to a pain pump that's about a softball size pain pump, and you can see there's a bunch of liquid in there and it's pressurized, so it delivers medication automatically at a specific rate. It has a regulator on it and it'll deliver 5 cc's per hour. It's equivalent to about a teaspoon per hour. That pump will last about 60 hours. So we hook that up at discharge. So your first 15 to 18 hours, your shoulder will be numb, okay? After that, you'll have the pain pump working for you for 60 hours. It won't be as strong, so it won't numb the arm, but it will blunt the pain. So hopefully you don't have to use as many narcotics afterwards. So the third day after surgery, that morning is when that pain pump will be empty. And you'll be able to tell the pump starts about that big and it just kind of gets wrinkly around the post in the middle of it. You'll be able to tell when it's empty. There are 2 yellow sheets of paper that you will be given at discharge, along with your other paperwork. One going over both blocks. One sheet going over the original block that lasts 15 to 18 hours that numbs the shoulder. And then the other yellow sheet's the nerve block with catheter, and that will go over the nerve block with catheter that lasts 60 hours. And it will illustrate some instructions on how to remove the catheter when it's empty. So if you had surgery Monday, Tuesday, Wednesday, Thursday morning, you would remove that catheter. And you do that at home. Just read down the list of instructions on how to do it. Very simple. Wash your hands, peel the tape back, pull the catheter straight out. It's not in a blood vessel, it's just in the tissue. It may bleed just a little bit. Put a Band-Aid over it, discard the pump in the garbage. It's better if you have somebody else do it, but the patient really could do it in a mirror if need be. Okay? So to start, directly after surgery, we do want the patients to use NSAIDs or an anti-inflammatory. It works fantastic after surgery. So we do recommend, ibuprofen, Advil, Aleve. They're all over-the-counter medicines. You will have a sheet of paper in your discharge that has our recommended dosing. So for ibuprofen, it would be 600 milligrams. That's 3 over-the-counter medication tablets, because those are 200s. So 3 of those is 600 milligrams, and to take that with breakfast, lunch, and dinner. Definitely want to take those with food, and I would take those for 2 or 3 days after surgery to give you a pretty good burst of anti-inflammatory on that shoulder. Also, we want, since the shoulder is up here, it's a little bit different when we say you want to elevate. Anything you have surgery on, you want to elevate to reduce the swelling. So it is the same as with the shoulder. So when you're sleeping at night, we do want you at a slight incline. It would be nice if we could get the shoulder still above the heart, which means not lying flat. So 30-degree incline, whether it's pillows under your low back and pillows under your shoulders to prop you up, or sleep in a recliner would be perfect. Another piece to that, so sitting a little bit upright, is going to be helping the swelling because your shoulder is a little bit elevated beyond the heart. And as well as, so the nerve block, the regional anesthesia nerve block that goes in here, does block some of the nerves that innervate the diaphragm. So some people, it's not very often, will say that they have a little bit harder time taking a deep breath. That's because it's numbing some of those nerves that are firing part of that diaphragm taking a breath. So it does help also breathing at a slight incline, sleeping and sitting at a slight incline, okay? The day after surgery, we want you to take an 81 milligram aspirin, unless you're on another blood thinner like warfarin, Coumadin, Xarelto, or something like that. But if you're able to take it, 1 daily aspirin, 81 milligrams, once a day for 2 weeks, and that's to prevent any blood clots, okay? So we have 600 milligrams of ibuprofen 3 times a day with food, breakfast, lunch, and dinner. You have the pain medication, whichever one the surgeon has sent in for you. Take that as directed. And then you also have the baby aspirin, the 81 milligram aspirin, once a day for 14 days. And that's a must. You don't want to develop a blood clot. We definitely want ice on the shoulder. You will have a pretty good size dressing here, kind of a bulky dressing on the shoulder. So the third day after surgery, when you pull that catheter, like I said, if you have surgery on Monday, Tuesday, Wednesday, Thursday morning, remove the catheter and remove the bulky dressing. If there's steri strips underneath the bulky dressing, leave those in place. And those are like little baby Band-Aids that go over the incision sites. But at that time, once the catheter's out and the dressing is off, you can take your first shower, okay? You will be sent home in a pretty good sling. The Ultra Sling is made to suit your arm and suit your size. It's fitted for you, and you should be planning on wearing that for about 6 weeks. And we want you in that sling all the time, even sleeping, unless you're showering or doing the exercises. And showering again is once that catheter is removed and the dressing is removed. So again, if you had surgery on Monday, it would be Thursday morning. And if you had surgery on Friday, Saturday, Sunday, Monday morning is when you'll pull the catheter and remove the dressing. So for the next 24 hours, no alcohol, no making any critical decisions. You had general anesthesia today, so you're technically considered intoxicated for the rest of the day. We still probably don't want you to drive with one arm anyway, until you have both arms able to use the steering wheel appropriately. We also want to make sure that you are scheduled for physical therapy. Usually that starts 7 to 10 days after the surgery date. So physical therapy is busy. Make sure you do call ahead and get that scheduled. That usually goes for at least 6 weeks of just passive range of motion at first before they even start strengthening the shoulder. You will be sent home with a bright green sheet of paper along with the 2 yellow sheets going over both nerve blocks and some other additional information. Make sure to refer to this. This will have all the basic information on it for the repair of the shoulder. And if anything is very specific to you, it will be written on this sheet. Okay. On the back side of this green sheet, I don't know if you can see that, but it is illustrated the instructions for the pendulum swings, which are the exercises that we're wanting you to do as soon as that initial nerve block wears off. So 15 to 18 hours after surgery, that next day, that next evening, when you get full feeling back in that arm, we want that arm out of the sling, dangling down as illustrated here. One arm kind of holding himself up, the affected arm, the surgery arm dangling down, and making small baby circles, clockwise, counterclockwise, 10 to 15 times each direction. We want you to do that 2 to 3 times a day, okay? And again, that starts after you get feeling back in that arm after the original nerve block is put in. So the next day, that evening, the next day. We don't want you to develop a frozen shoulder. Okay, so the last things to look for is if you develop a fever over 101, you take that dressing off and your shoulder is bright red, hot to the touch, looks like an infection, anything like that, please give us a call. You may have a little bit of drainage on the shoulder, but you shouldn't have a lot. And if anything like that, please give us a call here at the office. I think that's about it. There is a phone number at the top of the green sheet for emergencies, 24 hours a day. If anything emergency related comes up, please call that number. There will be an on-call doctor that will answer any questions you have. And you should have a follow-up appointment 1 to 2 weeks after surgery. If you have any questions before then, please give us a call. And thanks for seeing us at Slocum Orthopedics. Take care.